doing a consultation with a patient who I thought had a story to tell that everyone would be interested in hearing.
Okay, so a little bit about who I am. I'm 33. I'm a mom of 2. I'm a regular gym goer, averaging 4 to 6 days a week, and I have a very, I would say, moderately strict nutritional protocol. I'm considering the BBL, and the reason I'm considering that is I have been very patient and placed a lot of effort, kind of time, energy, discipline into trying to get my pre-pregnancy body back. I want to be able to bring back who I am underneath with a little bit of help.
So a skinny BBL is a BBL in someone who's skinny. Initially, we were not very keen on doing this because intuitively it doesn't make sense. You want to have someone who's got more fat to create a bigger butt, but what we actually found was that people that are skinny and have good amount of fat that can be used in the right places actually tend to get beautiful results. So we learned to love skinny BBLs. Love skinny BBLs.
I know that there's a lot of stigma that surrounds it. However, if we're going to do something for ourselves, right, and it makes you feel good, it gives you that extra bit of confidence or reveals a little bit of what that true shape is underneath, it's already part of you. It's always been part of you. You're just getting that little bit of help. There is no shame in getting a little bit of help that makes you feel good about who you are. My wish pick is actually myself after my first child. So I trained and I was able to diet myself back to somewhat of an athletic figure. You can see that there is a silhouette there that I'm hoping to identify with again.
The patient was an athlete, she was a bodybuilder, she was in a great shape. Recently, since having kids though, she gained some weight. Luckily, she gained it in all the right places. That means places where we can go and harvest the fat to transfer to the butt for the skinny BBL purpose.
I'm so excited. It's surgery day, and so no nerves. Thought I would be nervous, but I'm not nervous. I'm actually more excited than anything. So here we go.
Welcome back to the OR. Our second case study is going to be BBL, a skinny BBL. This is a lady with a pretty normal BMI. She doesn't have a lot of extra fat, so let's take a look at her. She has some fat deposits in her belly area and love handles, and this is where we're going to get most of the fat from. So we'll try to give her a nice hourglass figure and fill out her bum, give her a nice projection. So the first step is to infiltrate the tumescent solution. So this is a solution that helps to break up the fat, makes it easy to liposuction, and also prevents bleeding. So there's epinephrine in the solution. Epinephrine is a vasoconstrictor, causes vessels to constrict, and so there's less bleeding, less blood loss during the surgery. The liposuction technique I'm using is called safe lipo. There's many different ways of doing liposuction. Safe lipo is probably the one that's recognized as the best liposuction technique. Safe lipo is not safe. Safe is an acronym which stands for separation, aspiration of fat, and fat equalization. It's a three-step process to get the fat out and to create smooth results. So far we put in about 800 cc's of fat into this, so you can compare how much this one is sticking out more than this one. And we are done. That's it. What I find is that in skinny BBLs, when you have a limited amount of fat that you can transfer, somehow the survival rate is actually better. It seems like they're able to maintain more of the fat. Now, understand, when people do fat transfer, such as Brazilian butt lift, not all the fat can survive. And the reason for that is that when you inject fat, the fat on the surface gets its oxygen nutrients from the surrounding tissues, but the one on the inside suffocates and dies. And your body has to be really healthy and able to grow new blood vessels into this blob of fat to revascularize the fat that you've injected so that the fat cells get their oxygen nutrients. If they don't, they die. So there's always a percentage of fat that does not make it. Typically we say about 50% of the fat that was injected will not survive. What I found though in the skinny BBLs, this percentage seems to actually go up higher. We've had some patients, and you've probably seen these pictures online already, have beautiful results. It almost looks like almost everything has survived. So that's another reason why we love skinny BBLs.
Okay, so today I'm 5 days post-op. I'm feeling pretty good. As far as pain goes, I would say it's very manageable. I've been on my feet since Monday, which would be 3 days. So I'm mostly on my feet and my knees. I could do light housework. I've been back to work. I would say the only thing I feel is definitely very, very swollen, which is totally normal. I have a drain, so the drain side's slightly irritating, but nothing, too cumbersome. And I would say I'm just very tired in general. And other than that, I feel great.
She's putting out a lot of fluid. This is reddish fluid, this is no blood. This is called serous fluid. Had she not had a drain, it'd be collecting here. So we're gonna keep these drains in until she puts out less than 20 cc's. I think you'll be happy.
That's crazy.
You look so good.
I'm so happy. I'm just so happy. So I am currently 1 month post-op on my follow-up here, and I feel amazing. I am healing great. A lot of the swelling is gone, and the contour is beyond my expectation. I am so, so happy. So I do have some lumps and bumps, which are normal, and they will go away with lots and lots of massage. So that is going to be what I'll be working on for the next little while.
Let's see one.
Okay. Oh, I'm so happy. I swear. It's like to the point where I think I'm born with it now. It's like you can't even tell.
They can take several months, and I can help speed it up by doing a few little injections. Check something called Kenalog, and then you have to massage. So it doesn't work by itself, it just helps with the massage, okay?
That sounds great.
And when you massage, you might gently rub
Oh
it.
no, I go like fascial.
Yeah.
Yeah.
You pinch it and you
And I-
stretch it.
Yep.
Just like that. And you're
Yep.
trying to get this to soften a lot.
Wow.
Oh yeah.
Yeah. So it's pretty freaking awesome because like the contour's there. Like I'm wicked happy. It was beyond my expectations. Today I came in for my Kenalog injections, and I do have a fear of needles, so I got super nervous. I'm a little shaky and a little sweaty, but I'm really excited because it's supposed to help smooth out these lumps and bumps along with very vigorous and continuous massage. So that's what I'm going to keep working on, and I'm excited to see what that might look like at the next follow-up. You're so not my favorite person right now.
Do I try this one?
Okay.
Just like that. All the lumps. Yeah. Awesome. All right. So this is gonna give you 6 to 8 weeks. Let's have you back in 6 to 8 weeks.
Okay.
And do another round.
It's still a little bit lumpy in the front, but like I've been beating myself up with massages.
There's two things you're doing. You're squishing in all these lumps, so you
Yes.
try to squish them out.
Yes.
The other thing you're doing, you're trying to prevent the scar tissue that's sucking the skin to the deep layer
Okay.
and break it up. So you have a little lump, we're gonna massage it out, make it flat, and then you have a little area here that you see it's kind of stuck. By massaging, by stretching, you're trying to stretch and break little fibers that are forming and holding it down so it moves through.
Yeah.
So you have those little lumps and bumps holding you back, and that's how you're gonna get a nice smooth result. Okay, so massage after liposuction is absolutely crucial.
Yes. I've been feeling amazing, and I've been healing amazing too. Everything was just, wonderful, and I was really well taken care of by the team, so I'm so happy. I love it. I love my bum, obviously. It's exactly what I asked for. It was just a little extra curve and volume, and it looks great in yoga pants. I cannot complain. I absolutely love my new bum.
Like, was there a moment that you were like, wow, I love my body?
There was. I was at the airport. I did a little bit of traveling for work, and I had a really long layover. And then I went into just a store. I tried something on, and I looked in the mirror, and I was like, holy curves, this is gorgeous. And so, yeah, there was that wow moment. The decision to come to Dr. Six and his team was second to none. This was amazing and the best decision ever. The team was great. Dr. Six was great. The procedure was smooth, my recovery was great, and the follow-up, the nurses, all the team, communication was easy and fluid. The team was, they really looked after me, and so I had the most wonderful experience from start to follow-up to, I wouldn't even say it's the end quite just yet. So it's been amazing, and I could not say more impressive and better things about everybody here.